Welcome to Conversations with Black Doctors, brought to you by Austin Black Physicians Association, also known as ABPA. My name is Dr. Tina Ward. I'm a family practice medicine doctor in Austin, Texas, and I'll serve as the moderator for our panel. The mission of Austin Black Physicians Association is to improve the health disparities within our community and to inspire the next generation of Black physicians. If you're interested in learning more about our organization or want to collaborate with us, please visit austinbpa.com. Again, that's austinbpa.com. The purpose of these webinars is to bring health information to our community from trusted voices in the Austin area. We want everybody in the community to have the knowledge to care for themselves in the best way possible. Today's topic is disparities in diagnosis and treatment of obesity. This topic is important to ABPA and the African American population and community because obesity is a global epidemic, one that is most lethal health problem, one of the most lethal health problems in all of America, and has affected African Americans at a higher rate than other races. Right now, we are in the time of coronavirus, and we understand that obesity weakens the immune system, causes increased inflammation, causing more severe COVID-19 disease, and doubles the chances of death due to coronavirus. Joining us today are two Austin area Black physicians and experts on this topic, Dr. Desmar Walks and Dr. Monique Hassan. Thank you for joining us.
Thanks for having us.
Will you introduce yourselves, please, to our guests?
Sure. I'm Dr. Monique Hassan. I am a bariatric and metabolic surgeon. I am working at the Baylor Scott & White Hospital in Temple. And again, I do obesity surgery. That's 100% of what I do. And I'm dedicated to primarily focusing on our community and treating our patients.
Excellent. Dr. Walks?
Hello, my name is Dr. Desmar Walks. I'm a family practice physician and I practice lifestyle medicine. I treat chronic illness and disease and do sleep medicine as well, looking at the whole patient, and obesity is a large part of my practice.
Excellent. Thank you so much. So, Dr. Hassan, can you tell us how is obesity defined or diagnosed, and what is the impact on our health?
Yeah, so the first thing is that I want to say that obesity is no longer considered a cosmetic issue that is caused by overeating or lack of self-control. So that's the first thing. So let's get that myth out there. But it is a chronic progressive disease resulting from multiple environmental as well as genetic factors. It's characterized by excessive accumulation of body fat. And clinically, we define it as a BMI, which is a ratio of height versus the weight greater than 30. And then there's several classes of obesity going over 30. So class 1, 2, and 3. 3 is considered the more severe with a BMI greater than 40. And I think that in terms of how it affects our health, I think outside of the economics, because obviously obesity has a huge economic impact, but there's a lot of individual as well as societal impacts on our health, as well as longevity, as well as our psychological well-being. People with severe obesity, class 1 versus all the way up to 3 are more likely to have more diseases such as high blood pressure, type 2 diabetes, cancers are linked with obesity, as well as you mentioned before, deaths from coronavirus. And it actually can lead to early disability and early death if it's not treated.
Excellent. Dr. Walks, do you want to add anything to that?
I also see not only obesity impacting those medical conditions that we are familiar with, hypertension and diabetes, but I also see a large psychological impact on people who are obese. They tend to feel as though when they walk into the doctor's office, that they are being judged because of their weight and thought of as, doing this to themselves on purpose, or lazy, and not undisciplined. And that stigma makes it hard for them to even bring it up as an issue. And it takes a lot of sensitivity and timing, if they haven't already just come to you for weight loss, to bring that up in the conversation in a tactful manner so that they do not feel that that's what you're feeling about them. And then getting into some discussion about, as Dr. Hassan said, that it's not their fault, that there are some other things that are at play, and giving them the sense that together a plan can be worked out to help them get some resolution and lose weight.
Yeah, there's actually, just to also piggyback on that comment, there's actually a study that looked at how patients ask and present for bariatric surgery. And so our patients, we know, have been thinking about bariatric surgery for at least 5 years. And they have been actually going to their primary care providers or other providers and have, been asking about, weight loss or things like that. And basically they've been told, oh, well, you just need to exercise more and eat less. And we know that those are not the only ways to lose weight. And it's certainly, diet and exercise has never been proven to be sustainable, or to lead to sustainable weight loss, more than 40 or 50 pounds. Over that, when you're 200 pounds overweight, with a ton of medical conditions, it makes it very difficult for you to, get up and walk to the bathroom and exercise and do all the things that, would help, but you just need some assistance. And that's what I do. So,
yeah.
Well, one of the things we sometimes don't talk about is the genetic predisposition. Research shows that if you have one obese parent, that your risk of obesity is increased by 2 to 3 times. And if both parents are obese, by up to 15 times. Can you discuss some of the other obesity risk factors other than genetics that play a role in developing obesity?
Yeah, so I personally think that, especially within our community, I think that racism plays a huge role in development of obesity, because it leads to a systemic problem. Poverty is a huge component within the any low income population, not just underrepresented minorities, but also other low income populations. And so it's really hard to be able to buy healthy foods and live in neighborhoods that are walkable. Physical inactivity is one of the biggest risk factors for development of obesity, in addition to nutrition. And studies have shown that our patients are more likely to live in neighborhoods that are low socioeconomic neighborhoods, and those neighborhoods are less likely to be walkable, safe neighborhoods that actually contain supermarkets that sell fruits and vegetables and not high calorie, high sugar items. So food deserts are a huge problem. And I think that racism is one of those things that contributes to that. In addition to poverty and lack of access to healthcare resources, can lead to, you're just trying to survive. And so the last thing that you can do physically, when you have 2 jobs and you are trying to put food on the table, is go to Whole Foods and buy, $100 worth of anything. So it's pretty difficult for our patients, I think.
And Dr. Walks, poor access to healthcare or referrals to convenient and community organizations that help you lose weight. Have you noticed that it's very difficult for your patients to follow up, to discuss obesity and have multiple visits?
Yes, it is because of the cost of healthcare and the necessity in a lot of cases for them to pay co-pays. And just getting transportation. I practice in a rural town, so I have people that live on properties that are miles and miles away from here, and it's difficult for them to get in. It's also difficult to have access to dietitians and nutritionists who can help teach my patients and their families about healthy eating. And I think it also is a problem that you could address if you had better nutrition in schools and the access to food education in schools so that kids could learn about that. When I started this lifestyle practice, my goal was to teach parents so that they could be good examples for their children as to making good healthy food choices when they go to the grocery store. So that all plays a part in the development of obesity. And I see mother is obese, child's obese, and that's the pattern that goes on. That's part genetics and part because of what they're seeing as their parents are eating. And then I'd also like to add that trauma, early childhood trauma, that goes along with racism, which is an early childhood trauma for a lot of us who are Black Americans, and racism is a trauma to us as Blacks, and that affects our hormonal responses to stress, the stress of that, and I think that, you know, working through that all of our lives, it takes a toll on people, and then they end up in Dr. Hansen's office.
Yeah. Yeah, I think there's actually studies that show that, yeah, elevated cortisol levels that specific in the African Caribbean population, women have a higher levels of internalized racism, and therefore their actual, you know, their abdominal fat is increased as well as their glucose intolerance. So, you know, these situations that we are placed in can really affects our health. And stress is one of those things that we don't think a lot about, but it is a huge factor with obesity. And in addition, medications are a big problem. So, you know, placing patients on depression medicines, or the common one I see is prednisone, steroids. And those patients have been on steroids several times. You know, a lot of our patients have asthma, childhood asthma. They've been on, you know, anti-inflammatories and all these other things to control their asthma, which is absolutely appropriate. But the steroids then lead to elevation, you know, increase in their intra-abdominal fat. And that leads to their obesity and inability to lose weight.
So Dr. Waltz, can you tell us a little bit about PCOS? And when a patient comes in and they're obese, does the doctor actually do a workup? Do they check their thyroid? Do they check anything else, or just assume they're lazy?
No, we definitely do a workup. For me, I spend quite a bit of time doing a history to talk about their physical activity levels, whether they have a place where they can exercise, do they have something that they like to do that is physical activity that they can do in a sustained fashion repetitively during the week just to get out there and move. Do they have some physical condition like an arthritis in the knees or lower back pain that limits them? I ask them about their periods and lack thereof, and if there's been any difficulty with getting pregnant, all things that are related to some hormonal problems that we can associate with a condition that Dr. Ward alluded to, which is called polycystic ovarian disease. And then we also look at their sleep and whether or not they snore, and ask them about their level of sleepiness and other symptoms that are related to sleep apnea, like getting up in the middle of the night to urinate and sweating at night, and look at diabetes and whether they've had a family history of that. And putting all of that information together, then check hormonal levels to see if there's any problem with thyroid disease, which can contribute to obesity, or low vitamin D levels that are also associated with it, and whether or not they've tried to lose weight before, and what they've tried, and what they're looking to accomplish, what's their goal. And then very realistic conversation about, so are you a person that needs a diet plan, or are you somebody that just needs a little guidance on food choices? So that it takes time, and sometimes that can't all be accomplished in one visit, but the compilation of all that information helps you get to know the patient, and it helps that patient get to know you. And then you together can come up with a plan. And a lot of times, you're right, Dr. Hassan, there have been a lot of people that have been, but they really want to have surgery. And then we go through that process of, well, typically they want to show that you've lost weight for a certain period of time, or you've tried to, and then I send them to see a bariatric surgeon. And a lot of times we do have some success if we've made that process and that initial work of getting to know one another and getting a real good expectation of goals. Then when they lose weight, they are able to maintain that weight loss for a good period of time after the surgery. I find that if the work hasn't been done prior to the surgeon doing the work, that people will lose weight initially, but it's not sustained. So I think it's worth taking that extra time and before they go to see the surgeon, so that their job can be sustained. The work that they accomplish can be sustained.
Excellent. Now, I have heard people talk a little bit about the commercials. I don't know if either one of you have noticed that some of the commercials on TV are targeted marketing for unhealthy foods in the African American population. Can you comment on that?
Yeah, I mean, I've seen, as you said, it's usually high sugary, high calorie foods that, you know, are marketed to our population. And unfortunately, some of those foods, like we talked about before, are cheaper. They're easier to access. And, you know, if you are a single mom working and you have kids and, you know, you have 2 jobs and you're trying to make ends meet, it may be a great way to do that. However, unfortunately, those things are, you know, not healthy. And so they contribute to increase in our glucose, you know, dysfunction of our metabolism. And so they just contribute to the problem all over again. So.
And I think you mentioned, Dr. Walks, just the transportation to a lower cost store like H-E-B compared to the mom and pop stores. If you still go to the mom and pop stores, which you want to support in your own neighborhood, and unfortunately the cost is a lot higher. So you run into multiple problems with that. And sometimes if they do stock healthy foods, you know, you're not able to find the low fat options,
Right.
you know, and so people don't understand that the exposure to that is an issue.
Absolutely.
You know, that we struggle with, as well as access to care. So tell me a little bit about some of the treatment options for obesity.
So I can talk about the surgical if you'd like. I mean, the surgical options, a lot of times I see patients and we have 2, I guess, groups of patients. Those patients who meet insurance criteria for bariatric surgery, and those patients who meet just criteria for bariatric surgery. So I would say that the general criteria for wanting to lose weight and to seek a surgical option is someone who has a BMI greater than 30 that has some sort of comorbidity. And these comorbidities are typical ones: hypertension, diabetes, but then there's some atypical ones that most people don't think of: migraines, pseudotumor cerebri. I've seen patients who have infertility and PCOS. That is a treatable condition, and a lot of times it's due to being overweight. So unfortunately, our insurance companies have not caught up, and so they will not pay for bariatric surgery unless the BMI is over 35 and is associated with a medical problem, or your BMI is over 40 and you don't have any medical problems. So, so I do see a fair share of those patients, but my struggle is for the patients that are BMI 30 to 35. So while I would love to do it, and I, love doing surgery, it's really hard if the patient can't afford it in order to pursue it. There are medications, that are available, but again, one of the biggest problem is cost. Those medications a lot of times are not covered by insurance. So it's a frustrating battle for a patient.
Mm-hmm. Dr. Walks, do some of your patients come in asking about the herbal supplements and different other ways they can lose weight and little quick fixes that they've seen on TV? What is your recommendation?
Yes, we get a long list of what about the Dr. Whatever pill that I saw on television last night. A lot of people have had a lot of success with things like Weight Watchers and curves and those kinds of things. And some of that I think is not only due to not necessarily just product selections or whatever the product is that's being sold, but it's also because there is an accountability portion to that. Right. And a lot of times, they say it takes 21 days to learn a habit, and so, but it also helps when somebody has a buddy, a coach, somebody to check in with, and someone to support their quest. And so, really and truly, everybody's different, and they talk about precision medicine, and I think that in lieu of the surgical option, which is that's definitely going to get the job done, there are a lot of parts of this process that are relearning old habit, relearning and losing in the memory of old habits, not going for the mac and cheese that we all love at the dinner table on Thanksgiving, and going for the vegetables that are not full of cheese and breadcrumbs and all the good stuff that makes it taste good, and learning how to cook soul food with something that's not got a lot of salt. And I don't know about y'all, but I have a Caribbean background, and when I was less trim and skinny, they thought I was unhealthy. So I was trying to beat it up a little bit so I would not hear that anymore. Yeah. So we've got some cultural things to deal with, and we've got to learn how to love ourselves and turn off the noise of racism.
Right.
And I think that's
a really, I'm sorry.
I'm glad you brought that up, Dr. Walks, because one of the things that does happen is we have different videos, different songs, different things on TV that are encouraging us to be a little more overweight and more accepting of our size, and it's really not a size issue, it's more a health issue. Right. So we really need to be thinking about educating our population that this isn't about the size that you are, it's about your health. Right. And in your life. Right. So jump in, Dr. Hassan.
I mean, yeah, I was going to say, I mean, I had a patient, and I'm sure you guys have seen this, but I had a patient and she came to me and she said, you know, I don't want to lose my thick thighs and, you know, all this other stuff. And I said, I understand that, I hear that, but do you want thick thighs and diabetes, or do you want to be healthy, right? So, and she chose health, and she said, you know, and I said, it's not about your size, it's about your health, and it's about your quality of life. So if I'm going to add 10 years to your life, you know, I think that's probably the option that I would choose, and to not have to prick my finger multiple times a day, and you know, all that kind of stuff with my diabetes, and take all my diabetes medicine. Insulin is expensive, and bariatric surgery is one of those things that we know that can cure diabetes. So, I mean, you know, at the end of the day, I say, you know, right? And I always tell my patients, big boned is not a thing. It's not a thing. We are not big bones. Like, we all have normal bones, and it's okay. Like, we're supposed to be normal BMIs. So, so yeah.
And then, just as a personal aside, when I put that weight on, my cholesterol went up, and I'm like, and my blood pressure. So now I'm over a 27 BMI, and I've got what? Metabolic syndrome. Are you kidding?
Right. Right. Exactly.
Yeah. Don't go for it.
Exactly. It's amazing how much just 10 or 15 pounds, right?
Oh, I was so mad. I was so mad.
You know, some of the times patients would ask me, okay, is Atkins, Weight Watchers, which is the best diet? And I would have to say the one that you can stick with.
Right.
The one,
and I tell them the same. It's got to be a lifestyle change. You cannot think of it as a diet, because if you think of it as a diet, then you're gonna fall off the wagon at some point, right? So if you think of it as a total lifestyle change, and it's small baby steps, starting with, you know, I'm from the East Coast, so sweet tea to me sounds super foreign. I don't even know what that is. So I tell all my patients, you're not allowed to drink that. So that's got to go. That's the first thing. And then sodas have to go. And then, you know, gradually we reduce all these different things until, you know, you're just taking in just water, and, you know, healthier things, rather than these high calorie, high sugar, you know, things, and reading labels. Right. So we got to learn how to read labels and making sure that we know what we're taking in. So.
And I know the biggest complaint that I got from most of my patients were, I'm not a rabbit. I don't want to have salads every day.
Right.
You don't have to have salads.
Yeah.
How about green leafy vegetables? How about broccoli? You know, there's lots of options.
Yeah.
If we can educate our population on the healthy options, it'd be great. I have high blood pressure, as a matter of fact. So I read labels. I season. I, like you, Desmar, from Bermuda. I season my food beautifully without salt.
Without salt.
Herb. And people will say, you don't have salt in this? No. No, there's a lot of low sodium seasonings that we can use. So I think educating everybody is the key for most of us right now. What are some of the challenges that you have faced? And I know we're kind of wrapping up a little bit here. What are the challenges that you face in treating your Black patients with obesity?
I think, you know, I personally, I think that for the bariatric patient, it definitely comes down to some economics. So protein shakes initially are expensive. So we have to tell our patients up front, you know, you're going to be on some sort of a protein type supplementation for a few weeks after surgery. So that can get expensive. So if you're living paycheck to paycheck, here's the breakdown in order to help you. But the other challenge is, you know, making sure that they come for their appointments, because transportation is an issue. And where I am in Temple, I am a tertiary referral center. So patients come from Dallas, they come from all over to see us. So that is a challenge. And then the final challenge is just making sure that they understand that bariatric surgery is a tool. It is not the be all end all. I mean, as much as a surgeon, as much as I would love to think that, but it really is just another tool in your armamentarium to help you in the fight of obesity. It's, you know, and that's it.
Dr. Walks, challenges?
The challenge is to get some buy-in so that when they have plateaus, when they've gotten some gain, or should I say loss of weight, and then they hit a plateau and we need to kind of recalibrate, like, you know, you get them to stop drinking the soda because they come and they say they're not eating a lot, and then you go, well, what are you drinking? And that's when you figure it out. Okay, so, and then they stop and they lose a bunch of weight, and then you've got to make another tweak. And that's when it's hard to, and that's not just for Black patients, that's for all patients.
Right.
But that, I think, is the thing that is hard, is to get that sustainability of it, because we all want fast food, we all want fast fixes for things, and it's a lifestyle change.
Mm-hmm.
And, you know, I'm sure many of our people watching and our viewers would say, hey, I'd love to have Dr. Walks and Dr. Hassan as my doctor, you know, but we can't all go see both of you. So are there any misunderstandings that non-Black doctors have about treating obesity in Black patients? And if so, what kind of questions would you have the patients say to their doctors and speak up for themselves, to advocate for themselves in the treatment of their obesity?
I would start off by saying very forthrightly that, you know, I realize that I have a problem with my weight, and I also realize that it's going to affect my health, and I would like you to help me with this. Just be straightforward about it, because I think if you tell somebody that you know that this is a health problem and that you're coming to get help with a health problem, then that dispenses with this notion that I'm a Black woman and I'm overweight because I sit around and watch TV all day and eat, because that's not what we're doing. We are working, we are juggling a job, the children, the husband, the whatever family drama we've got, and racism, and we need help. So let's cut to the chase and do something. You know?
Right. Yeah, I agree. And I think that the other thing I would tell patients is to be persistent.
Yeah. So
when you see one person and they say no, you need a new doctor. And I've said that to patients. You know, they said, I've been to my primary care, I've been to this doctor, I've asked them about, you know, my weight, and they never told me that I was overweight. And I went to go see a joint doctor for an X replacement, and they're the ones that sent me here. Because I can't get my knee replacement because I'm overweight, and they told me I need to lose 50 pounds. I mean, that's crazy. And I'm like, no, you need to lose 150. So, you know, it's persistent, and realizing that there's several studies that are out there that show that, you know, African-American patients don't do as well with bariatric surgery. And so why should we offer it? And so there are, you know, physicians out there or providers that are out there that think that bariatric surgery it doesn't work, or, you know, they don't do well. And so therefore these patients, they don't need a referral to it. And so, you know, that's frustrating for us from the surgeons, because we know that it does work. The studies have shown it. So we have now, you know, 20 or 30-year data that show that. So I think the most important thing as a patient is to be an advocate for yourself. So.
Mm-hmm. Excellent. Well, we're nearing the end of our talk today. If you could tell our audience one thing about obesity in the Black population, what would it be?
Don't give up. Find somebody who will listen, and then walk that road with them, and you can do this. you deserve it. You deserve good health.
Yeah. I would also agree with that. I would say that, you know, also this is a medical problem, just like high blood pressure, diabetes, all sleep apnea, it needs to be treated. And even if you don't have medical problems and your BMI is over 40, that still means that you need to be treated for your obesity. And your quality of life is important. And a lot of times those are the things, the little things like not being able to sit in the appropriate chair or, you know, get on X ride at the amusement park. Those things matter. And those are the things that really are contributing to potentially depression. So those things need to be treated and you need to be persistent.
Excellent, excellent. Are there any resources you'd like to suggest to learn more about obesity and weight loss?
Yeah, so for our perspective, the asmbs.org website is really amazing. It has a lot of patient data. Obesity Action Council as well has a ton of data. And I personally, I'm okay with Dr. Google. I'm okay with patients Googling things and looking things up so that I can, you know, I can actually dispel those myths. So I like that. And I like patients to come with lots of questions, watch the YouTube videos of surgery and watch people's stories. So that's important. And Facebook groups are also really important and good resources, I think, for patients, because then they can talk to each other and understand what's going on, how this is affecting them. So.
Dr. Watts, did you want to add anything?
No, I do want to say that when the medical option doesn't work, I think it's very appropriate to go and see a bariatric surgeon. They can help you get that initial hurdle of the weight loss started, and then you can afterwards maintain your lifestyle goal of continuing to keep your weight down by seeing, you know, a primary care, endocrinologist, whatever. But I really believe that we need to get the word out there that bariatric surgery is a good option for weight loss, particularly in those people that are above BMIs of 35, who can have that insurance coverage for it. So,
yeah.
Excellent. Thank you so much, Dr. Hassan and Dr. Watts. We are grateful for your time and expertise today. Thank you, our audience, for joining us wherever you're listening from. ABPA wants to continue its mission to improve the health disparities within our community and inspire the next generation of Black doctors. Please visit our website at austinbpa.com. If your organization would like to partner with us or has any questions or information or topics you'd like for us to discuss in our future upcoming webinars, please, austinbpa.com. Thank you again.
Thank you.
thanks.